Good morning. My name is Kendrez, Holland. I'm part of Flat Labs on the mentorship of Andrew Shockey, and my project is microfluid device for monitoring drug inherent and HIV positive patients. HIV is a drug that originated from Africa and has spread into the United States, and is in most cases are currently located in the southern region of the United States. We're kind of in the middle of the Manhattan. 12% of the U.S. population is African American, but 44% of new HIV infections are African American. Antiretrovirals are viruses that inhibit part of the viral life cycle and prevents the virus from replicating. It is important to adhere for antiretroviral drug adherence. What I mean by adherence is that sticking to the regular doses that the doctor prescribed. Poor adherence can lead to death. Also, a drug-resistant virus, which can be dangerous because it would be hard to find an antiretroviral in which it can manage the disease. So, with notifying the doctor earlier, the patient can be taught back into adherence to that drug. Pre-exposure prophylaxis is when the person who is at risk of getting HIV take antiretroviral to decrease their chances of infection. So adherence is critical. So we need a cheaper way to determining if a patient is adherent to that drug, because so we can stop the chances of the drug-resistant virus, which is will be hard to manage. Because the techniques that are used today to determine if a person is adherent to the drug is very expensive, and also we need it because of the low resource settings such as Africa, where HIV is prevalently located. Here we use zymography, which Katrina described earlier, just points out cathepsin activity. Here are zymos of patients, and the baseline patients are patients who have just been diagnosed with HIV and are not on antiretrovirals, whereas 6 months later their positive signal went to negative, and and we can use this observation to determine that zymography can determine if the patient is adherent to the drug or not. Here, one from PI Dr. Clapp and mentor Andrew Shockey went to Illinois to work on a cheaper way to determine if a patient is adherent to the drug. It's called a microfluidic assay. The microfluidic device, first a drop of blood is added to the device, and then lysine buffer is added to the device to lyse all the red blood cells, leaving on the white blood cells. Then quenching buffer is added. Quenching buffer is added to the microfluidic device. Quenching buffer is added to the microfluidic device to put the white blood cells back in the isotonic environment. Then the cells of interest, then the white blood cells are counted, and then antibodies are bound to the cells of interest, which are monocytes, and then they are lysed, and then other cells are brought to this chamber, then the cells of interest are going down to a pre-made gel, and then it's going through the zymography process. So my project is to determine volume of blood that was required to get a positive signal on the zymo scale. I also culture monocytes, which secrete cathepsin. Cathepsins are used in zymography. So here I did a BCA. Here I did a BCA and quantified the protein concentration and made a graph which gave a curve which we can determine a certain protein amount. Here I did a zymo with different numbers of monocytes, but here I have a raw, but I didn't get no signals out of the monocytes due to low numbers of cells. Here are PBMCs. PBMCs are just white blood cells just all the white blood cells, which has a total of 5 milliliters, which show slight positive cathepsin activity, whereas monocytes, which were tested on the chip, and they was collected in fraction, which show little to no cathepsin activity. Here's patient-to-patient variability. You can see that patient A has no cathepsin activity, and patient B has the positive cathepsin activity, and you can tell that different patients have different cathepsin activity. So conclusion, antiretroviral adherence is vital. Also, protein per cell curve can be used to improve the microfluid device assay, and also that patient-to-patient variability can be determined. Variability in conducting activity can be different among different people.
Questions for Kendrez?
Any questions? Any questions?
Silly.
Yeah.
If you can produce a process that's cheaper, would that be easier for small clinics? And we always think about third world countries, but we have communities that don't have healthcare centers.
Mhm.
So would that be able to have a first world application in places that have populations that aren't treated or who don't have access to hands-on treatment and help with staying on their meds?
Yeah, but of course, because like you say, it's cheaper, so the microfluid device will help determine if a person is, well, yeah, it's on antiretroviral. It's on antiretroviral, and